Now, this is. I'm going to give everybody an opportunity on the panel to reflect on the theme of the conference, and to provide us perhaps with what they think are the most significant issues that that they have been thinking about in the course of today. Most of you have been here for most of the day, so I'll start with Hanny here, and you're just about to have a drink. So sorry, Hanny. I'll hand over to you, and perhaps you can start us off. Thank you.
Okay. Thank you very much, Demos, and thank you for asking me to come and be part of this conference. Can you hear me? And to be part of this conference and to be on the panel today. Basically, today I found that it was mostly about connectedness. So being connected with oneself, with what our thoughts are and how our thoughts affect the way we feel and how they affect our stress levels, and to be connected with how these work and to be able to make a distinction between what is absolutely real and what is illusions in our minds that we create as we are trying to deal with a problem which we run through our mind quite a few times when actually, you know, that's not how things are going to happen. But also to be able to listen to our patient and to listen to them quite clearly about what they're here to tell us and to try and understand them. And I think the other connection is to understand what it means to live with a mental health issue, not just simply what are the dental problems and how the medications that they're taking, how would that affect them, but what does it really mean and how can we help support them and not add to their burden by asking them to do a whole lot of things that may not be extremely helpful to them. And that sort of aligns with the other issues. I mean, whether you are a victim of family violence or whether you are on drugs or whether you've got a mental health issue, we need to be able to connect with what does that really mean and then how we can help them.
Okay. I'll have to fess up that I wasn't here for the early parts of the conference. So I only came along to give the presentation that I was involved with earlier. However, looking at the agenda, what I've heard, and also what's been said, it made me think about when I started off as a young lawyer, and you sort of approach things as legal issues. And I think what the conference is talking about is a point I tried to make is that. I suspect oral health, legal issues, mental health, all those issues, none of them will stand alone and sit alone. Therefore, the solution for them is not a standalone solution. As I said before, the legal issues I well know, you just do not excise them out of the person's life, wrap them up, stick them on the shelf, and then focus on that and deal with it. And I expect that it's exactly the same for the issues that you all deal with. The challenge, I think, is, and I gather is an issue for you all, is trying to get the oral health issue up the ladder, as it were, in terms of the punter, if I'm allowed to still use that word, seeing that and recognising it as something which is important and does have to be addressed. As I said, just making an appointment and taking them into a nice, clean, schmick room somewhere where it looks very impressive, that's not going to win the argument for you. What's going to win the argument is that whole concept of integration. If they can see that connects and you can show them that it connects to other issues in their lives, that will win the argument for you. That's when they will see the importance of it. That's when they will draw. It'll all come together for them. And as I said before, it won't be some blinding moment of insight that they have. It will build, and it will build gradually. And I gather, and I think that that's probably the issue, and I hope that's not me ringing, the issue that is... I shouldn't have brought attention to it, sorry, mister. That's going to be the issue, I think, that you all face, because it's certainly the issue that I've faced as a lawyer. It's the issue that we faced at 614. I can't say that we got it exactly right, but we're working at it.
As a mental health advocate, I go back to the Therapeutic Alliance. It's that relationship, it's that connectedness that I have with my health professionals and the community that I have around me that helps me to feel that I can actually approach the person that I'm working with in co-production, in co-partnership for my health and well-being, and that helps me to be self-determined enough to take that role of taking responsibility and being the author of my own life. Now, the Minister made a wonderful comment that is so timely, given the monumental, fabulous news that the mental health sector has been working on endlessly, that was announced yesterday by the Prime Minister and by the National Mental Health Commission, that is now about putting the person at the centre of care, at the centre of community care, so that we are part of that recovery process and part of all the elements of health. And as you've mentioned with the dental approach, the dental care approach, we can't separate ourselves. Human beings are mental health, physical health. We've got all of those elements and more. And so we have to work together as a community. The current models of medical health do not work. So by being honest and being out there and developing relationships and learning from each other as we have today. And I have to say thank you to all those wonderful people who've come up to me to share their own journeys, to actually express that they've learnt something, because I've learnt something from you, that the more we listen, the more we share, the more we can learn from each other, so that the models that we're wanting to achieve and to see, so that our children and their children can benefit, can actually start now, and that we're in a space that we can do some fabulous stuff. And with the announcements of the last 2 days, I actually see this as a monumental start to a real change in the way we deal with health and well-being on a prevention and early intervention approach, rather than waiting for the whole house to fall down and a crisis to hit. So thank you for the opportunity to speak today.
It's pretty hard to follow that. One of the things that I've found really intriguing about today is that I think within the oral health arena, we've been looking at new models of care, new ways of doing things. I think we've been thinking for quite some time that if we keep doing it the way we've always done, we'll always get what we always got. And we know that that's not working. And I think a lot of that is because we probably haven't been taught a lot about that mindfulness and that listening. And I think today is a great experience where we're actually listening to people in other areas dealing with different issues that have come up with better ways of doing it than we have. And we are learning really quickly, and we're on a pretty steep learning curve, I think, about how we can do things. But I've been thinking a lot about things like family violence, a lot of things that have been happening in clinical environments where people have been almost professional bystanders to inappropriate clinical care and not feeling comfortable enough to stand up and say no. And I think mindfulness is actually probably one of the solutions. If we could actually sit down and learn how to do that better and how to speak up and how to listen, I think that we'll be in a very, very different place with our models of care in the future. So thank you for helping me with the journey today. It's been really, really good. And I'm sure all of us are in that same situation.
Well, I guess I should say I also only saw the afternoon sessions, and for me it really reminded me of a book I read recently by a Dutch philosopher called Anne-Marie Mol called The Logic of Care. And she writes a lovely thesis where I think it's very true for our health system. We're quite focused on, the rights of the citizen and the logic of choice, that people are consumers of healthcare and we provide a service and then they choose to take it, and governments have to work out how many people have a condition and how much it will cost to provide a care, and then if they want the care they should come and be good citizens. And I think that's a lot of truth in our model of healthcare, and I thought that juxtaposed beautifully with Penny's presentation, which fits with what Anne-Marie Moll calls the logic of care, which as health professionals, we work within a system that has certain expectations and budgets and expectations of citizens, but in the hard reality of life, we actually have to do all kinds of interesting things to try and make the system work for the people who are most vulnerable. And I think that's the bit that we often forget when we're researchers and we're trying to fix the system. So I particularly appreciated that was the presentation that closed the day.
Thank you very much. I've always wanted to do this. I want to be Tony Jones. So I don't quite look like Tony Jones, but that's, sorry? No, not Carl, not Carl. I do change my suits a little bit more often than Carl, but I certainly want to be Tony Jones. I think he's got the best job in television. Okay, it's over to you now. You've had a whole day of fantastic presentations, really interesting presentations. I just want to make one remark before we hand over to you. People might not realise, but the oral health program at North Richmond is our biggest program. There's 50, more than, Martin, is that right? How many? 40 staff. Okay, so it's the single biggest program and has the most interactions with our clients, both in terms of clinical care and other services that it provides. And it provides care not just here, but in nursing homes, in schools, up at Robinvale with the Aboriginal community, in East Timor. It's got an incredible reach and it's got the most incredible set of people and that's the sort of thing we want to focus on. How can these 40 people focus on improving the oral health of the community? I think that's really where we want to head, to have that discussion with everybody. So over to you now, and you can ask a question of any of the panel members. I might take some things as a comment, and of course, and Penny over there, she can ask Penny any questions as well. Anybody that was on the previous panel as well. So over to you.
All this afternoon speakers, and thank you everyone, all this afternoon speakers talking about providing quality oral health care to very complex clients who are people who need to build trust. We have to build two-way trust if we're trying to develop any sort of therapeutic relationship with any of these clients. And sorry, I'm getting all confused now. But basically, it all requires time. Our current funding is output funded at a very low level of care, low level of funding, and it requires bums on seats, funds treatments only. It doesn't give, so we lose money. The agencies who are treating more complex people and spending time actually don't make any money on that. So it doesn't encourage this sort of appropriate care and appropriate time, which is incredibly important. I work in an agency where we see a very large percentage of people with serious chronic mental health issues, people with drug and alcohol issues, people who are homeless, and it's often a combination of all of those things with sort of very complex lives. You know, any suggestions on how we survive this and keep ourselves healthy while trying to improve the health of our clients?
For you, Marianne.
I've always felt a particular sympathy, I'd have to say, with anyone working in oral health, because you have the added disadvantage of people lying back with their mouths wide open, and it's pretty hard to have a conversation with someone when a fair amount of the consultation time they can't speak. Look, the shift from outputs to outcomes is something that governments are continuously grappling with. I'm exceedingly sympathetic to the situation that you've raised, and in the health sector there is no doubt whatsoever that we don't yet have any of our funding mechanisms right in terms of meeting or rewarding the outcomes that we are seeking, and in terms of understanding and recognising, as you say, that you are, and we want you to see the person and to see the whole person and understand that people present with a life and experience and situations that make their own self-care really challenging. So I'm going to squib on answering it directly because that's sort of outside my actual expertise. And authority, I might say as well, because I'm not a minister. I'm only a parliamentary secretary. But I think it's a big challenge. How do we shift from funding outputs to outcomes? It's not just in health, I might say. It's also a challenge in education, in justice, and it's one that countries like ourselves around the world are grappling with.
Anybody else?
It's always the fun one to answer this one. Look, I think that from a public dental health point of view, there's been people for decades working tirelessly to try and deal with these sort of issues, which is, I think, why we're spending so much time looking at models of care, making sure we're providing the right services, challenging the way that we do things to try and make it the most efficient we can with the small amount of resources that we have. I mean, we have been fortunate in the last few years that the Commonwealth Government have put in some money, but it's the boom and bust stuff that we always are quite challenged by as well. And I know the government is currently looking really hard or trying to negotiate through with the Commonwealth at the moment to try and secure future funding. But the actual rate and everything, and that's something that also the state government has committed through DHSV's Statement of Priorities, so our annual agreement, is to look at what is the rate that it should be as an annual rate for the whole sector within Victoria. But the one thing that is pretty clear is virtually every clinic that I go to across the state, everybody is dealing with really, really difficult cases. They're different in different places. You've got different issues. But there are challenges, and one of the things that I would never ever advocate is that you should be dealing with the person. You should be actually making sure that you have got the appropriate care, but evidence-based care. I think some of the challenges we've got in our model of care is to start really thinking about what we're doing, and that gives us some opportunities, and thinking about who should be doing the care, how can we provide it. I think there's some real opportunities. So we can still improve even within the agenda, even within the envelope we have now. But when you think about the fact that we're only treating about 26% of our eligible population within a 2-year period, we're not even touching the sides. And even though I know there's a lot more homeless that are being seen, a lot more Aboriginal and Torres Strait Islanders in the last few years, you've all been seeing so many more, getting to those really vulnerable groups, we're only touching the sides. So we've got a long way to go.
Okay, so just like on Q&A, we have a question here that Jess is going to read out for you. We have a question by email.
Okay, so this is one of the questions that was texted through. So often these types of events bring together like-minded people, aka the already converted. How can we better engage and encourage more oral health practitioners to get on board and make a paradigm shift in their clinical practice?
Terrific, thank you. Maybe handle that one. You might want to start with that one.
So the question is, how do we get others who are not like-minded to have the same sort of thinking? Well, it's around trying to get to, well, I'm just trying to think how we would actually get to them. It's by things like this as well, is by advertising these conferences widely and encouraging people to attend, or people who are in policy decisions or dental professions, or the groups that actually would assist with making decisions, and trying to get the message out that by simply doing what we are currently doing is not changing anything. And also looking at the research, the data that's coming out, and making that available to the profession as a whole, or to everyone within the profession, so that they can see that either the dental services, the cost or the burden on health of dental services that are being provided is continually increasing. It's not actually decreasing. Looking at the data that shows how the oral health of the public patient is improving. But we need to get that information out either in dental journals or in newsletters or through the professions, I think.
Yeah, I was going to say, story, maybe my legal background, but storytelling is a very powerful means of getting the message across. I accept entirely that data is important. You've got to gather data, you've got to collect the stats and so on. I mean, that's where you make your dreaded business case when you're going up before the bureaucrats or to government and so on. But always you buttress it with the story. On that document there, which is a bit of a summary of some of the work that we've done at Urban Justice. In the back of it, we put a few what we call case studies, which are stories about people that we assist. They're the things that get people's attention. They're the things that make the impact. I mean, you can talk about the percentages of this and the percentage of that and so on, and that's clearly relevant when it gets to crunching the numbers. But it's the stories that really hit home with people. My colleague Luke Geary in Sydney, he has the luxury of an organisation called Salvo Legal, which is just a sensational model that I want to get happening down here, where he has two law companies. One's a for-profit, transactional commercial legal enterprise. They make money, and lots of it, and they fund their Salvo Humanitarian, which is basically the equivalent of what I'm doing, but a whole lot bigger. What Luke does is collects the case studies, and every client at Salvo Legal who is on the paying side, when they get their final bill, they also get this little booklet which has got a little couple of pages about what they're all about, and then it's got a whole lot of case studies. And that's where he gets his response. That's people come back because they say, oh, we read that case study, because they can see that the fees they're paying for the service, that's fine, but they can see that the profit's going off and it's supporting Salvo Humanitarian over there. That's where it gets the impact in the storytelling, and I think that that's really important, and that's what you want to spend a bit of time on. If you're doing stuff, show people. I mean, we take people into the cafe all the time and walk them through the cafe, and the visual impact is incredible as they go through and they see homeless people. As I said before, it's like any cafe, and the visual impact of it is just amazing. Come out the other side, and Brendan's usually got them getting the checkbook out and writing checks for us, which is good. But it's just that visual impact. It's so important.
I was going to add that what we've done in the mental health sector is share those stories and share them widely and incorporate them into a variety of different programs. And I'd actually like to go back a step and suggest that we look at our education at undergraduate level so that we ensure that the stories are actually told to our next generation of dental students at the curriculum level. And my dream is to actually see mental health at every subject, at schools, in universities, so that we all get to understand and learn from the lived experience, because this is storytelling that, as we know this afternoon, I got a lot of hugs, my daughter got a lot of hugs, we exchanged them. It is the power in us sharing what it's really like being on the receiving end, and as your customer service, we're all customers, we're all consumers of a whole range of different things. If we can give a voice to that, then we can help improve, tailor, tweak, tell you what works, tell you what doesn't work, so that we're all better able to work together. So it's that sharing of knowledge and expertise, sharing of what works, what doesn't work, and then also going back to one of the initial questions around self-care. Self-care is also something we have to do for ourselves, because at the end of the day, we are looking after other people. And if we don't put the oxygen mask on ourselves first, we're of no good use to anybody else. Our kids next to us in the plane are going to pass out. So we've got to be there first, or we'll pass out. And so at the end of the day, education is what will start to change paradigms.
My name is Maha Gabriel. I'm the unit head of special needs dentistry in DHSV. I've been a dentist for 30 years, 27 of these in special needs, and 14 of these is the unit head. It's actually education, as you said, Ingrid. You know, we have the dental students in our unit. Every student comes and spends a week at least in our unit. And my charge nurse used to tell me, here we go, when do I put their name on the roster? Because we have what we call try before you buy. Anybody who would like to come, you know, to trade with us, to see how we do domiciliary visits, how we treat, you know, people in homeless clinic or whatever, the door is always open. And we do, you know, a simple accreditation for them so they can come with us and see the work and how it's done. And more often than not, they actually want to be employed by us. And that's why, you know, my charge nurse used to say, you know, you're throwing your web around them, and when do I put the name on the roster?
Yes, that's right. So how does the panel see oral health fitting into the NDIS?
Start this end again, or the other end. Go to the other end this time.
I don't think anyone here has a crystal ball. So, I mean, every time I go to a meeting about the NDIS, I come away less clear as to how it's going to work rather than more clear. I went to a meeting in Canberra only, I think, a month ago where there was a discussion about whether people with serious mental illness would even be able to access respite services through the NDIS. So I think it just captures that these very incredibly important things, even though the people who are on the ground know they're incredibly important, have a lot of concern about how they will be properly met. And I guess we'll have to wait and see. It's only yesterday that they announced, you know, the new mental health reform. It sort of sounds nice and shiny on paper, but all these little things, the risk of the most vulnerable falling through the gaps is, I think, quite high.
Certainly my initial investigations into it is oral health hasn't been included at this time, but it is at this time. And I think one of the things that we need to really look really carefully and have a lot of learnings from is that whole concept of consumer-directed care. And I think we have to be prepared for that, and probably need to make sure that and a lot of what we're talking about today is along those lines. We need to make sure we design our new models of care with a very strong consumer-directed care model.
I was just going to add, I think, as with the NDIS and mental health and how we fit into all of this, we've all got different elements that we need to incorporate in that whole of person care model. How it's going to happen, as Caroline's alluded to, it's always great in theory, and I'm actually really hopeful that yesterday's announcements are going to work, but then it boils down to reality and practical logistics and how this is going to pan out when we start. And then things evolve, things change when we're actually out there. But it's not about us not saying anything, it's actually using that opportunity to keep saying, hey, look, we've got to keep doing this, don't give up, let's try different things. So we've just got to keep our voices up about oral health and its importance on the NDIS.
Don't ask me anything about NDIS, I'm still trying to figure it out.
Look, I might make one comment, and it picks up on what Deborah said. I think it's that whole shift that we are seeing. We're talking about person-centred care, but person-directed purchase of services. And I think, and I'm talking as a consumer, that the challenge in oral care is to ensure that the community has a good understanding of the services that you offer and the preventative role, the very important preventative role that you have, an educative role, particularly thinking about with children, mothers and babies, how you are positioned to be there as a constant in the lives of children and families. So building the knowledge in the community of the services, and indeed understanding what will happen if we do not have good oral health care. So that would be my comment.
Thank you. Okay, back over to you now. Anybody? Yes, down the back there.
And the workforce, like who will hold all this number of patients which we're going to experience from now onwards with this patient-centered care? Who will provide that service? Because we know that not many dentists in public sector.
Look, I think one of the things that, like this is one of my, I get on my hobby horse about this one, workforce. There's quite, we have to actually recognise that model of care is a lot of people, and it's not actually about dentists, and it's not actually necessarily about providing direct dental services. Most of the people that we actually do see in a clinical environment actually get seen by lots and lots of other players. They get seen by midwives, they get seen by pharmacists, they get seen by GPs, they get educated at schools. We need to make sure that those people are actually driving the message home, the oral health. They've got to be the oral health advocates. And it's about working in partnership with all the people at this table. It's about making sure that they understand, we understand their issues as well. And I think we're going to get a lot better outcome than that. When it gets down to getting actually into the clinical environment, then I actually believe there's a whole team of people that can provide services. We now have dental assistants with Cert 4, and in fact here at Richmond there's some fantastic examples of people that do that actually form a very significant part of the treatment model and the care model. And then there's oral health therapists, there's prosthetists, there's hygienists, there's a whole pile of people before we get to dentists. And I think in Scandinavia there's quite a lot of models where the whole service is actually managed by oral health therapists or hygienists, and dentists aren't actually a major component. So I'm not sure whether you're using the word dentist as dentists or whether you're talking about dental practitioners, but I actually think a lot of the services need to be actually provided outside of the dental environment if we can. I'd also be into having other people providing fluoride varnishes that aren't dental people, but that's against the Act. But maybe I'll talk to the Parliamentary Secretary afterwards.
Thanks, Deb. We have another question on SMS.
It's our last question. Okay, this is another workforce-related question, I suppose. In a challenging widget-driven environment, how do we enable mindful practice in oral health to ensure that we can be more attentive and in the moment for our clients, particularly those who are most vulnerable?
We'll start down here again.
Well, that's a pretty hard question. I mean, I think the first thing is to practice mindfulness every day for yourself, and pay attention to those moments which we all know as health professionals come from time to time when we get kind of irritable and short-tempered, and people we're looking after don't do what we say or frustrate us, and then the system comes along and makes it even harder for us to help them. And I think mindfulness has a very big role in our own sense of well-being. I have a few very choice quotes from the Dalai Lama that one hangs above the patient's head that reminds me about compassion and tolerance. And I have another one right next to my computer that talks, the famous Dalai Lama quote about how we spend all of our time trying to achieve something for the future and forgetting to live for now. And I'm amazed just by having that in my room how often people comment on that. I think the dentist that I go to since the 1960s has always had a Japanese garden with a beautiful environment and soft music, and creating an environment that doesn't need a lot of money, but just creating an environment where there's less stress. And I mean, coming to this building now after having visited North Richmond in the old days, I think it's an example of coming in and going, wow, I feel at home. This is a place that's caring and respectful rather than grungy and dingy. I don't want to give the impression that I think buildings are the answer to mindful practice. I think it's the people in them, and I visit an awful lot of nursing homes, and I can tell you the nursing homes I want to go to. They're not the ones that are the fancy-looking buildings. They're the ones where people are greeted with a smile and a caring voice and everything else. But I think they're the kind of things that make us mindful, looking after ourselves and working in an environment where we don't tolerate, abuses to our senses.
This is that double-edged sword. How do we actually be the carers of other carers if we don't care for ourselves, which is what we've all been alluding to in different ways? And I suppose this is where I'm a work in progress. There are no silver bullets to any of this, except trying and finding what works for us, and what that might mean to one person may mean something totally different to somebody else. It's going back to what is our hobby, what is our passion, what do we love, what is it that helps us recharge our batteries? Because at the end of the day, if I don't put fuel in the car, I know I'm not going to get very far that day. I gave my car the other night actually to my husband. It was great because I had his brand new one, and he rings up and says, well, the battery just died. That says a lot about my self-care and the car's care. At the end of the day, it is about us recognising and acknowledging that sometimes life isn't going to be okay. That sometimes life is damn tough. Something hurtful might happen. Something difficult might face us. And I'm thinking that for so long we've all been expected to keep going in society no matter what. We're warriors. If we're working, we've got to keep working no matter what, and leave our personal stuff behind in one room and then go to work, put in a disguise on and pretend that we're separated human beings. We're not. It does show we are human, we are flawed, we make mistakes. We've got to try and learn how to recognise the signs and symptoms of before we get to that point of when our alarm bells are ringing and saying, hey, look, you know what, things aren't going that well. I'm getting a lot of bugs and lurgies, I'm starting to get more irritable, I'm starting to get not eating well. What are all those things, and then what are your strategies? Caroline's got some beautiful strategies in place. You may have different strategies that work for you. I know that in our family we've got guitars and those funny mindfulness colouring books, we beat them. My daughter and I have been doing those for years and they're wonderful. So whatever switches your button to give you that break from technology, break from conflict, break from stress, look to whatever that means. And it might even be for some people something spiritual. Let's not forget that part of our being. I'm not here to actually give you those ideas of what it means, because it means different things to different people. But all I will say is find it and nurture it and give yourself some me time.
Spiritual, you mean sport?
Your interpretation.
So, I wouldn't add a whole lot. Looking after yourself is very important. Just myself, it's been an interesting experience for me working with the group that I'm working with now at the Salvos. And one of the really, self-repair, refreshing things, I find, and it's a bit bizarre, but I can walk down Burke Street now and there are people, sitting begging, which is not that flash, but a whole lot of them know me, and I can stop and have a chat with them. There's a bloke called Tony outside the 7-Eleven, and Tony has never turned up to a single appointment I've made with him, but and he's missed the odd court case too along the journey. But we got this terrific relationship where I'm walking on the other side of Burke Street, he'll start screaming out to me, and I come over, and it is nice to sit and talk with Tony, I find, and with Phil and a few of the others around the place. But it's a strangely refreshing thing for me. I guess I come from a background where I'm used to clients who, criminal lawyers always get their clients to pay up front because they're either leaving by the side door and you're never going to get any money, or if you're successful and they leave by the back door with you, they never want to see you again because they want to put that experience behind them. But to have clients who want to stop and have a chat with you in the street is a very refreshing experience, I can tell you, from an old-time criminal lawyer. Self-repair and look after yourself is just so important. It's a real issue in my industry. I see a lot of colleagues who crash and burn along the journey, or get involved in some of the substance abuse that we've been talking about. So it is so important, that whole looking after yourself.
Thank you. Well, mindfulness is about taking care of yourself, but also it's about listening to your patients and noting exactly what their issues or what the problem is. And I think the question was talking about widgets and how we're going to count the widgets and so on. Well, I think the importance is about having a team of players so that you can identify what the actual problem is with your patient. But you, as a dentist or a dental therapist or a dental hygienist, may not need to actually address all of the issues, so that you can refer to an oral health educator, or you can refer to a hygienist or a therapist to do different parts of the job while you go on and do the parts that you are absolutely skilled in. So it's a team approach. It's understanding what your patient is. If we don't understand our patient and what the issues are, we are actually building a rod for ourselves, because we are going to provide the wrong treatment, which will come back to haunt us, and then we actually are delaying other people coming into our service because we are repeating services that shouldn't be repeated.
And I'll give the final word to Mary.
Oh, thank you. Well, on that question, I was thinking about in terms of how I manage myself, I suppose, and to me, there are two words, passion and purpose. Passion is about the things that I do that I love to do, and they're simple things. Reading, reading literature is what I love to do. But in terms of staying focused and in the moment, for me, it's about remembering my purpose and why I've put my hand up to do what I want to do. And that is a very energising thing for me. It also means that you can get rid of distractions and things that are not aligned to your purpose. You can leave aside. Because in politics, it is easy to be distracted by issues that are outside what you really want to achieve and why you're really there, which is always, regardless, I would say, of what side of politics people are on, they're there because they want to make a difference in their community, and you need to continue to remind yourself what it is that you're trying to change and what you're fighting for, and that can help declutter your life, actually, by being very clear about your purpose. But have a passion, which is something you really love to do just for yourself. Thanks.
Thank you very much. And we've gone a bit over time, so I want to thank everybody. We don't have any more time for any other questions. So, if you please join me in thanking the panel. Now that's the last Q&A for 2015. So just before we head off to the pub, I've got a few, just a couple of. I think Rachel's going to have a few thank yous. Is that right?
No more thank yous. We've done a lot of.
Well, I'll just do one thank you then. I'll just do one thank you. First of all, I want to thank the panel members. It was absolutely fantastic, and you answered all the questions with great candour and energy and passion. So thank you to the panel members. Thank you to the audience. You've been a fantastic audience today. You stuck with us till right up to 6:05 on Friday afternoon. You've done incredibly well. Thank you very much for your participation. But a very, very special thanks is to the volunteers, all those wonderful young people. Please thank them who've given up their time and made the day flow so much smoothly.